Ooh, I should. I slick. These are gonna die. This one's gonna die. It's fine. It is fine. All right. Giving y'all some time to come on in the room. All right. Hello, everybody. I knew it was gonna die. Can y'all hear me? My AirPods died. Let me just give me a thumbs up if you can hear me. 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 Okay, perfect. All right, so hello everyone. All right, so Nurse Sam here. Welcome to NCLEX Jeopardy Thursdays. Okay, see, I kept my promise. We're bringing We're bringing NCLEX Jeopardy to TikTok. Jesus Christ. We're bringing NCLEX Jeopardy to TikTok. Okay, a lot of you guys asked for me to bring this fun and free review to TikTok. So that's what we're doing. Okay. All right, let me go ahead and bring it up. So if you do not know what NCLEX Jeopardy is, I guess it's an 80 and now I gotta get all my NCLEX info first. Woohoo! Awesome, congratulations. All right, so if you don't know what NCLEX Jeopardy is, that is our, like I said, free and fun NCLEX Jeopardy style review. Okay, it's basically we're going through practice questions, NCLEX practice questions for both RN and LPNs. Same thing, okay? Well, the NCLEX, the questions. We're going through those questions and we're doing it in a fun, in a group setting. And we spent about an hour, and like I said, it's just like Jeopardy. In fact, I'm going to bring it up so you can kind of see visually what I mean. All right. So my name is Nurse Sam. I'm a licensed practical nurse. I am the CEO and founder of Nurse Sam Global Media, where I create fun and creative study guides, study aids, resources for nursing students and pre-nursing students, so that you guys can, especially for all my visual learners, you guys can retain and recall more and actually have an enjoyable time actually studying instead of overwhelmed and having a panic attack every 5 minutes like I was. Okay, so all of our material, all of our resources are either colorful or it's like themed after something to make it really fun. So that it's not so overwhelming. Okay. All right. So I'm just making sure. All right. So this is basically what our NCLEX Jeopardy looks like on our screen as we play it. Okay, so this is our comprehensive review. So we're going to have 5 categories. These are our 5 categories: pharmacology, pediatrics, mental health, fundamentals, and adult health, which is basically like med-surg and stuff. And we're going to have there's 5 questions per category, just like Jeopardy style. It's ranging from 100 points to 500 points. And how we play is that it's like every man for himself, every follower for himself, his or herself. When I put up the questions and you see the question, the answer choices, and you go to answer, of course, just like Jeopardy, you have to answer Jeopardy style. So you have to say what is before you answer. Now, I will say this. The actual NCLEX is not Jeopardy style, okay? It's not like a competitive exam. This is just themed after Jeopardy just to make it fun and, like I said, not overwhelming, okay? You'll be surprised at how much you actually learn and retain when you're not, like I said, having a walking panic attack, when you're actually enjoying and having fun as you're studying, okay? So once again, I'm going to put up the answer, well, not the answer, I'm going to put up the question. You're going to read it, you're going to answer, and say what is, like I said. The first person on my screen to answer correctly is going to be the winner of those points. All right. Now, I do have my handy dandy scoreboard, so I'm recording the person that gets it correct, I'm recording your usernames and then keeping score that way. Whoever has the most amount of points at the end of the game is going to win a free Ultimate Nursing School bundle or a free full version of the NCLEX Arcade. Okay, both of those are top bestsellers for not only like new nursing students, but students that either just graduated and are really preparing for NCLEX. They're both geared towards obviously passing the NCLEX. So it's going to review comprehensively. It's going to review all the important stuff and cut out the fluff. And like I said, because we like to do things, we like to entertain as we retain. It's all like themed and colorful and just really, really fun and cute. Okay. All right. So if y'all have any questions on gameplay for NCLEX Jeopardy, just drop your questions below and either I'll answer or somebody else will answer. All right. Tag anybody that needs a free and fun NCLEX review, whether it's RN students or an LPN, LVN student. Everybody can benefit. Okay. So let's go ahead and get started. Okay. Some of them, because of this specific feature, some of them may be kind of, you may not be able to see like the corners of all the questions, but I'm going to read them out loud. And if there's any type of, if there's anything that I definitely need to like say out loud, I'll just let you guys know. Okay, so if you guys are ready, right, you must say what it is before answering. If you guys are ready to play NCLEX Jeopardy on TikTok, give me a thumbs up. Give me a thumbs up if you are ready to play. Okay, hold on. All right, we have our thumbs up. Let's go ahead and get started. First question. We're going to go with the category fundamentals. All right, this is fundamentals for 300. Okay, it says the nurse is, this is what I mean by like some of them are cut off. The options are 1, 2, 3, and 4, just to let you know. It says the nurse is creating a plan of care for a client scheduled for surgery. The nurse should include which activity in the nursing care plan for the client on the day of surgery? 1. Avoid oral hygiene and rinsing with mouthwash. 2. Verify that the client has not eaten for the last 24 hours. 3. Have the client void immediately before going into surgery. Or 4. Report immediately any slight increase in blood pressure or pulse. Remember, this is Jeopardy style, so you have to say what is before putting your answer if you want it to count towards points. If you're just here for the review and you just kind of just want to answer the review, you don't want to be considered for points, then you don't have to say what is. Okay, but if you want the points, which will put you in the running to possibly win a free Ultimate Nursing School bundle or NCLEX Arcade, then say what is. If not, then don't say what is, just answer. Okay? All right. So I'm seeing a lot of people say 2, which is verified the client has not eaten for the last 24 hours. All right. Let's go ahead and see what your answer is. Effects. The answer is what is 3? What is 3? Thank you for breaking that down in real time. It's Brina, by the way, because that's literally exactly why it was number 3. All right, so the answer is what is 3? Have the client void immediately before going into surgery. All right, it says the nurse would assist the client to void immediately before surgery so that the bladder will be empty. Okay, quick little tip. All right, whether you're studying for the NCLEX or whether you're going to be taking the NCLEX Next Gen or taking the NCLEX, the current NCLEX, which is going to be before April 1st, 2023, anything after April 1st is going to be the Next Gen. All right. One of the big things that I saw when I saw sample questions and when I started to get more information on the next gen, is that they are really they're really testing to make sure you guys comprehend why you're doing certain actions, why you would do actions, like why. Okay, so whenever you have whenever you're studying, or even whenever you're answering these questions, ask yourself why. Okay, if the answer, for example, was what is 3, have the client void immediately before going into surgery. A good way to study for both the current and the next gen NCLEX is to then ask yourself why. Okay, make sure you know the reasoning and the rationale behind why you're going to be doing whatever intervention, because you will be tested specifically on that on next gen. Okay, all right, so yes, you do that so that the bladder will be empty. Okay, now oral hygiene is allowed, but the client should not swallow any water. Okay, the client usually has a restriction of food and fluids for 6 to 8 hours, okay, or longer if prescribed, before surgery instead of 24 hours. Okay, so great job, Isbrina, BTW, for catching that. Yes. Can you imagine not eating a whole day before your surgery? Right. That's just, that is a lot. That's a lot. Okay. That's a long time to go without any type of food or water. Typically when, with surgeries, what you typically see, either it's that standard 6 to 8, or they'll say, nothing to eat or NPO after midnight. And surgery is usually like 7 o'clock, 8 o'clock, whatever, that next morning. So it's still within those parameters, those time parameters, but that can still like fluctuate. But 24 hours is just too much. So that's why it wasn't that one. Okay, and then a slight increase in blood pressure and pulse is common during the preoperative period, and it's usually the result of anxiety. Okay, that's why I said a slight increase. Didn't say like a markedly high increase. All right, just pay attention to those words. They mean things, so they can also be hints. All right, so who's the first person to get what is 3? Future ER said yes, because a full bladder will cause complications. Absolutely. And then it also depends on like the type of surgery, where they're getting that surgery. But because they usually get fluids during that surgery, you don't want to add on to an already full bladder. Does that make sense? All right, first person to get what is 3 on my screen is, hold on, future ER nurse. Future ER nurse, you want your points, right? I'm asking. Of course, you make sure they, right. All right, first person to answer that was future ER nurse. Oh, she doesn't want her points, so we can go to the next person. She's won many times. Also have everything. Awesome. So we're going to go, we're going to give it to the next person that said what is 3, who is Shanita's Blessed Creations. Awesome job. All right, Shanita, you are on the scoreboard with 300 points. Blessed Creations with D. Awesome. All right, here we go. Let's go ahead and get into our next question, which is, wait, sorry, I keep doing that wrong. What's our next category? We just did fundamentals, so let's do adult health. Let's do adult health. All right, yeah, we started at like 7. That was our first question. Okay, we had a whole rundown, but we just started basically. We started at 7. All right, so adult health for 300 says the nurse is evaluating goal achievement for a client interaction with impaired physical mobility. The nurse determines that the plan of care needs to be revised if which outcome is noted. 1, intact skin surfaces. 2, bowel movement every 4 days. 3, active range of motion of uninvolved joints. Or 4, absence of redness and swelling in the affected extremity. What is our answer? Remember, this is Jeopardy style, and we are playing for points. So if you want to be considered for points and qualify for points, then you have to say what is, just like true Jeopardy style, okay? If you don't want the points and you just want the review, then just put the answer. You don't have to say what is, okay? So it's up to you. The winner with the most amount of points will win a free Ultimate Nursing School bundle or NCLEX Arcade. Okay. All right. So once again, the nurse determines that the plan of care needs to be revised if which outcome is noted. All right. Always reread the question, at least the last line of the question, so you can remind yourself of what the question's actually asking you and not what you probably made up in your mind what you should answer. It happens. It happens to the best of us, but that's why you learn these strategies so you can avoid making these mistakes. Okay. All right. So I'm getting like 2s, 3s, 4s, really mostly 2s though, which is bowel movement every 4 days. So let's go ahead and see what our answer is for adult health for 300. All right. Drum roll, please. The answer is, what is 2? Bowel movement every 4 days. Good job. All right, it says the bowel movement every 4 days is insufficient. Okay, remember the question said which of these would indicate that the care plan needs revision. Okay, so with that question alone, or the way that's asking, we're looking for an outcome that is not ideal. We're looking for, maybe an unexpected outcome. Okay, remember care plans, you use those and they're created so you can do interventions, and so the client can do actions and interventions that would help them meet their goal. Okay, so with this question, we're looking for something that will not help us meet a goal or is indicative of that patient not meeting their goal. Okay, it says the bowel movement every 4 days is insufficient. The client should be having a bowel movement a minimum of every other day. Expected outcomes for impaired physical mobility for the client on traction include absence of thrombophlebitis, all right, which is redness and swelling in the affected extremity, active range of motion to uninvolved joints, clear lung sounds, intact skin, and bowel movement every other day. Okay, so first person to get, first person to get what is 2 and win those points is Jasmine Carr. All right, congratulations, Jasmine. Great job. Jasmine.CAKAUR. Awesome. You have 300 points. All right, so you and Shanita's Blessed Creations are tied right now. It can still be anybody's game. We have many more questions to go. Okay, great job to everyone that said 2. Please know that if you are using this review, just like with anything else, make sure you're using this review to your advantage. Okay, not only are you testing your knowledge and really testing your comprehension, just kind of see what you remember and for your focus studies and stuff, but make sure even if you're getting questions wrong, you're taking advantage of that. Okay, not all wrong answers are bad. Okay, is it disheartening when you get a question wrong? Absolutely, absolutely. But as long as you see why you got the question wrong, and why the right answer is right, then you're really taking the most from it. Okay, that's why we always say that practice tests and taking those practice questions are always going to be one of your best ways of really, being able to retain and recall that information no matter what it is. Okay, because those practice questions are going to give you kind of like a hint of what to expect on the test. And that's just, honestly, that's the best experience you're going to get outside of it actually being the test. And trust me, you'd much rather get questions wrong with me, on TikTok, on our live, than actually on the exam, on the day of exam when it really counts. Okay. All right, so let's go ahead. I'm trying to mental health right now, so I'm loving this. Whoop whoop. Future ER nurse, are you signed up for NCLEX Trick or Treat, our October little campaign? All right. Next question, guys. All right, that was adult health. Let's do mental health. Speaking of future ER nurse, since you're in mental health, let's do a mental health question. All right, the nurse caring for a client diagnosed with severe depression is planning activities for the client. Which activity would be most appropriate for this client? 1, drawing, or just drawing, period. 1, drawing. 2, playing checkers. 3, painting by numbers. Or 4, putting a puzzle together. Remember to say what is, if you want points. Remember to say what is. This is Jeopardy style. Okay. Wait, how can I get a good NCLEX for associate degree? You got to do that research yourself, love bug. Yeah, quick little Google search so you can see your area, different programs in your area. Have at it. All right. I'm seeing my pasta. I don't know how I ended up here. For good luck, everyone. All right. I'm getting a little bit of everything. Getting a little bit of everything. Okay. All right. When it comes to mental health questions, and we'll discuss how to study for mental health next week, which is week 3 of our NCLEX Trick or Treat extravaganza. It's our virtual study group, basically. We're going to specifically talk about how to study for mental health and how to answer those questions. So what I will let you guys know is that when it comes to mental health, you have to ask yourself who you're talking to. Who's your client? All right. Now, obviously, diagnosis and manifestations, that plays a big role in nursing, just period. But when it comes to mental health, like you have to cater your interventions towards, once again, the individual patient. And you don't just have a normal patient. You may have someone bipolar, schizophrenic, all those different mental health disorders require a different type of intervention because the way that they present and what maybe triggers them differs between the two, or differs between those different disorders. Okay, so just know that you definitely have to watch the wording of questions. All right, so once again, who are we talking to? Our client is someone that's diagnosed with severe depression. All right, what activities will be most appropriate for a client with severe depression? Let's look and see what that answer is. Mental health for 200. Boop. The answer is, what is 1 drawing? What is 1 drawing? Okay. Why? For everyone that gave me their answer, why did you choose that? And if it was just because I guessed, that's fine. You can be honest. You can say, no, I guessed. But once again, the point is that even if you do guess, get it wrong, get it right, at the end of the day, I want to make sure you guys know why this answer is correct. So that if you see something like this or something similar on NCLEX, your nursing school exams, the ATI, whatever, you have that basis. You have that foundation of comprehension, if that makes sense. So I guessed, period. All right, so the answer is drawing. So concentration and memory are poor in severe depression. Okay, so when a client has a diagnosis of severe depression, the nurse needs to provide activities that require little concentration, such as drawing. Okay, activities that have no right or wrong choices and that require no decisions minimize the opportunities for the depressed client to experience a sense of failure, which will definitely make that depression worse. And then it says the remaining options do not meet the criteria and are incorrect. Okay, so let me see what y'all saying. Yep, it required the least thought process for the client. Great job, Court. It is a way of release, but all of them are pretty much ways of release, Kimura. You have to think about which way of that release would be the most appropriate for this specific client, okay? And specifically, it's because it requires little concentration, right? It's the easiest task. It requires a little bit of concentration, right? Great job. We're reading everything that you guys are saying. Great job, Tori, future ER nurse. Is it promote cognitive skills? Not necessarily. That even cognitive skills, you don't want to be promoting any type of like building of skills because once again, concentration and memory are poor. All right, great job. I didn't know, but now I do. Boom, exactly. I didn't know before, but now I do. That's the whole point of NCLEX Jeopardy, really of anything that I have. As long as you leave here and leave time with me, learning something that you didn't know before coming to this live, I have succeeded and done my job, okay? All right, so let's go ahead and go to the next one. Wait, who got these points? Hold on. So who said what is one first? Let me scroll. Or said drawing. But you remember, you have to say what is because this is Jeopardy style. Maria, you said drawing, but you didn't say what is. But great job for getting drawing. Great job for getting it correct. First person to say what is one is Taylor 214. Awesome job, Taylor 214. You on the scoreboard with 200 points. Awesome. Okay, and great job, like I said, to everyone that got what is one. Remember, Maria, you have to say what is in order for your answer to qualify. Anyone can play. Yes, you can play. All right, let's go ahead and get into the next question. Let's do peds. Pediatrics for 300. I've been saying it all game, Maria. Don't give me that face. The nurse is reviewing the laboratory results for a child scheduled for a tonsillectomy. The nurse determines that which laboratory value is most significant to review. 1, creatinine level. 2, prothrombin time. 3, sedimentation rate. Or 4, blood urea nitrogen level. All right. The nurse determines that which laboratory value is most significant to review. All right, that's the question. What is our situation and who's our client? All right, this is peds, so our client is obviously a child. They didn't give us an age. Quick little hint, whenever, like I said, know who you're talking to. Know who you're talking to, know the situation, and know what the question's asking. Okay, so when you're going through the question and trying to figure out who your client is, if they specify an age and or a sex or gender, let me say that, pay attention to that, okay? Because from experience, if they specify that this is a 15-year-old child versus a 2-year-old child, there's a reason why that is being specified, okay? Especially in pediatrics, all right? Anyway. So yes, we have a child. They didn't give us age, they didn't give us gender. We have a child that's scheduled for a tonsillectomy. All right. Now, which lab value is going to be most significant to review? Okay, tonsillectomy is a surgery. Okay, so what is important? What lab value is important to review before any type of surgery? Okay, so let me see. Remember to after you answer, tell me why. After you answer, tell me why. Okay, now let's go ahead and see what our answer is. Don't forget to tell me why. All right, and drum roll, please. Our answer for peds for 300 is, what is 2 prothrombin time? What is 2, prothrombin time? It says a tonsillectomy is the surgical removal of the tonsils because the tonsillar area is so vascular, all right, full of veins, just all that. Post-operative bleeding is a concern, absolutely. Prothrombin time, partial thromboplastin time, platelet count, hemoglobin and hematocrit, white blood cell count, and urinalysis. Those are usually performed preoperatively. Okay, the prothrombin time results would identify a potential for bleeding. So, ooh, claps to everyone that caught that. All y'all that said about clotting time, absolutely. Okay, because depending on if that's high, normal, low, that's gonna let the surgeon and you know where they would stand as far as risk for bleeding. Ooh, you see how I threw that nursing diagnosis in there? Risk for bleeding. Okay. It says creatinine level, sedimentation rate, and blood urea nitrogen that would not determine the potential for bleeding. However, I will say that even though those were not the correct answers for this question, make sure you know what those levels indicate. So just in case you have a question like this and maybe it's like remixed and maybe they're trying to get you to identify something else, make sure you know, once again, what lab values indicate what, represent what. Okay, just put a little in this over there in the corner. Just say, okay, creatinine level. I know this is indicative of what you would do. Creatinine. Let's do it together. Creatinine level will let you will be is giving you information about what part of the body. Creatinine level. What are they looking at? If they're looking at creatinine levels. Kidney function, absolutely. Absolutely. Creatinine level. Okay. Now on the new NCLEX generation, they're going to be giving you guys the normal reference ranges. Okay. Now I know you're probably like, oh, thank goodness the new next gen NCLEX is going to be giving us the value. So half that work is already done. Yes and no. But once again, that's why I said not only is it important to know what those values are just for you, whether or not they're going to give it to you or not, you need to know how it looks when those levels are off in any way. How it looks when it's high, how it looks when it's low. And not when I say how it looks, I mean how the patient will present. What type of signs, symptoms, manifestations will you expect to see in a client whose insert lab value is like off, if that makes sense. Okay. Sedimentation rate, what's that? What are we looking for with sedimentation rate? Same thing with blood urea nitrogen. What are we looking for? What are we looking for with sedimentation rate and blood urea nitrogen? Infection, inflammatory yes, absolutely. Absolutely. It's specifically like a measure of inflammation. So it's really, you see it drawn a lot in someone who is trying to either rule out or confirm like autoimmune. If their body is full of like inflammation, and that inflammation can come from a number of things, whether it's like infection or once again like an autoimmune type of inflammation in the body, it definitely is going to be indicative of that. Okay. Now, blood urea nitrogen. Thank you for your future ER nurse. Blood urea nitrogen is kidneys, BUN. Okay. So like I said, just make sure you know that. Who got prothrombin, or what is 2 first for this one? Why am I so into this game? It's so fun. It's like, are you smarter than a 5th grader? That's kind of how I feel when I'm doing it. Especially like I've been a nurse for 8 years. And even as I do these every Thursday. Even as I create these or put them together for you guys, I take them as well. And I'm just like, oh, this is so fun to take. Especially since the pressure of, whether or not you're about to pass or fail NCLEX is off of you. And you're kind of just taking it leisure. It's way more fun. All right, first person to get what is 2 is Tori Riggle. All right, congratulations, Tori. Great job. Tori Riggle, you are on the scoreboard with 300 points. Awesome job. All right, so we have Shawnita with 300, Jasmine with 300, Tori with 300, and Taylor with 200. Okay, we still have questions to go. So let's go ahead and so I'm not a nurse, but I want to participate. Go right ahead. Go right ahead. All right, next question. My husband is not a nurse at all. He has no medical training at all. And he be trying to answer these questions too. He be swearing, he be getting it right. He talking some blood urea nitrogen is for nitrogen. It makes no sense. But once again, it's just fun. Next question. Farm for 400. What's that? I'm a PN. Awesome. So am I. I'm a practical nurse too. Yay. All right. Farm for 400. A clinic nurse is performing an assessment on a client with rheumatoid arthritis. I said toward. Rheumatoid arthritis who has been taking acetylsalicylic acid. Great. For the disorder. The nurse assesses the client for signs of aspirin toxicity. Which findings should alert the nurse to the possibility of toxicity? 1. Fever and signs of hyperventilation. 2. Constipation and abnormal bloating. 3. Client complaint of visual disturbances. Or 4. Abdominal discomfort and client complaining of diarrhea. Which findings should alert the nurse to the possibility of toxicity of aspirin? Okay, whenever you see acetyl salicylic acid or ASA, ASA is aspirin. Okay, ASA is aspirin, and they will. I don't know what part you guys are in or what section you're in as far as your nursing program, but when you get into farm, aspirin toxicity, it may even be like half farm, half med surg too. Aspirin toxicity is like drilled into your brain. That's one of the things that you will definitely be tested on. Okay, so make sure you know the signs and symptoms of aspirin toxicity. All right, so another thing, quick NCLEX strategy. When you see options like answer choices that are compounded, and by compounded I mean like number 1 says fever and signs of hyperventilation, both of those have to apply. Both of those have to be true in order for that answer to be correct. So don't let the fact that like a compounded answer, maybe one of them or 1 out of 2, 2 out of 3, whatever, one part of that sentence is correct, don't. If you know that one part's correct and another part's incorrect, then do not choose that answer. Okay, the full statement, the full sentence, whatever, both options, both choices have to apply and have to qualify, have to be correct. Okay, so just know that. All right, so let's see what the answer is. Question, my instructor said they are changing the NCLEX test by the time we graduate. Right. So, Gianni, earlier, you may not have been here when I mentioned earlier, but if you're taking, if you're graduating / taking the NCLEX on or after April 1st, 2023, you're going to be taking next gen NCLEX. If you're taking it between now and April 1st, like right before, then you'll be taking the current NCLEX. okay? The content will be the same. You got to know aspirin toxicity, whether you're taking the old NCLEX, the new NCLEX, doesn't matter, okay? What will be changing is just the breakdown, the outline, and how they formulate and format those questions. That you're going to have a bunch of alternative question types. That's not just multiple choice. It's still majority multiple choice, but you're going to have those different formats. And I said it before, one way for you to definitely study for the next gen NCLEX using like the current NCLEX format that you see is to ask yourself why. Always know why. Always know the rationale behind every action, every intervention. Know why you're doing something before you do it. Okay? So that's going to help you significantly. Okay? So just get into that habit. All right, let's go ahead and see what the answer is for this. What is this, farm for 400? Aspirin toxicity. All right, so let's see what the answer is. Drum roll, please. And what is one? Fever and signs of hyperventilation. Okay, so it says mild intoxication with aspirin, all right, or ACA or ASA, I'm sorry, is called salicylism and can be experienced by the client when the daily dosage of acetylism of acetylsalicylic acid is more than 4 grams. Okay, tinnitus or ringing in the ear is the most frequent side effect noted with intoxication. I'm gonna say that one more again, okay? If you do not know this, and if you were not like taught this before, or if this is your first time seeing it, trust me when I say this is going to be key in some type of pharm test at some point, all right? Tinnitus, or AKA ringing in the ear, is like the number one most complained about side effect of aspirin toxicity. Just know that. That's all I gotta say. All right, and then it says hyperventilation that may occur because salicylates stimulate the respiratory center. Fever may result because salicylates interfere with the metabolic pathways, coupling oxygen consumption and heat reduction. The remaining options are not signs of acetylsalicylic acid intoxications. Okay? I don't care. Oh, then why are you here? All right, let's go ahead. Let me see what y'all saying. And first. Who said it is one first? Who said it is one first? Wait, what is this? What was that one? Scroll. This is Porsche. This is Porsche or this is Portia? Teresa also got it. Great job. All right. So once again, where'd you go? Where did you go? This is Porsche. All right. Congratulations. You are on the scoreboard with 400 points. Porsche won. Was it? It wasn't last week. I think it was Tuesday that you won, right, Porsche? Ooh, please tell me which one it is. Porsche. Okay, thank you. Great job. Someone said farm test in the AM. Ooh, awesome. I concur with Alyssa. You're gonna get 100. You're gonna pass that. Oh yeah. Oh yeah. You definitely came in mid-question and got it. Awesome. So remember, not a lot of people got that one correct. Once again, do not beat yourself up about it. It happens, whatever. What I want you guys to take away from it is that now you know. If you didn't know about that before, and once again, you can assess that based on whether or not you get questions right or wrong. If you get it wrong, then you can just put a little star in the corner. Farm, aspirin toxicity, side effects. Symptoms of. Just put it in the corner that you know you need to brush up on this specific content area. It's fine. And then after we get off live, do that so that next time you see it, you don't get got again. Okay? I say screenshot this one. I'll put it in my stories. I'll put it in my stories as a thing as well, as a actual question for you guys. All right, so let's go ahead and get into the next one. This is Farm 400. Boop. All right, Adult Health for 100. All right, the nurse is assessing a client newly diagnosed with mild hypertension. Which assessment findings should the nurse expect? 1, asymptomatic. 2, shortness of breath. 3, visual disturbances. Or 4, frequent nosebleeds. Don't forget, this is NCLEX Jeopardy, Jeopardy style. So you have to answer it in Jeopardy style. You have to say what is before your answer. So if you think the answer is 3, you need to put what is 3 in order for you to qualify for points. Okay? Asymptomatic means no symptoms. Oh, you weren't asking that as a question. That was you were just saying what is asymptomatic. Okay, my fault. It's 1, 2, 3, 4. By the way. People saying 1. Okay, remember why. Ask yourselves why. Someone, whatever y'all are answering, tell me just really quick. Give me a summary as to why you chose your answer. Okay, why did you choose whatever one you chose? Okay, remember, we're assessing a client newly diagnosed with mild hypertension. Mild hypertension. Okay, we're trying to find the assessment finding that is expected in someone newly diagnosed with mild hypertension. Okay, so let's go ahead. While y'all telling me your whys, let's go ahead and put up the answer. And the answer is, drum roll, please. What is 1, asymptomatic? Somebody said it, and I was like, you better go, girl. The answer is, what is 1, asymptomatic? All right, hypertensive clients, they often have no symptoms until target organ or target organs are involved, or target organ involvement. Okay, and that happens once again with very high blood pressure. All right, that's why hypertension is usually called the silent killer. You really don't know what's causing a problem until it gets into the severe range. Okay, with very high blood pressure. All right, that's when you start actually seeing, manifestations and symptoms occurring because of the very high blood pressure. All right, and then it says the remaining options are incorrect because those clinical manifestations occur once again with severely high hypertension. All right, let's look and see what y'all are saying. First, put this back up. Let me see who got what is 1 first. I can give you your points. First person to say what is 1 or what is asymptomatic is... Wait for it. Okay. Taylor 214. Awesome job. So Taylor, you have 200 points. Just got this one correct, so you get another 100. So you now have 300 points. All right. Awesome job. And when it comes to your whys, I remember you guys saying, someone said it better not be asymptomatic. No, symptomatic yet. Okay. Right. Victoria said it because it would take a long time for that stuff to happen because it's mild. Absolutely. Absolutely. Oh, that's y'all getting it right. Look at y'all. I'm so proud. Shush. It's Keld. Mandy. Great job, guys. All right. Let me see what you guys are saying. I wish I had fun earlier. I'm still life past my. Oh, congratulations, Vane. LPN life. Whoop, whoop. All right. Great job, guys. The veterinary school, but here I am. Awesome job. I'm graduating medical school this year. Yeah, you're cheating. Congratulations. Great job. Love that. Medical school. Ooh, wee. All right, guys. Great job with that one. Make sure you pay attention to like adjectives before diagnosis. All right. Mild hypertension is not the same as I'm gonna say medium. It's not the same as severe hypertension. You know, mild, just like acute is different than chronic, mild is different than severe. Okay, so pay attention. Which it looks like a lot of you guys did. So snaps to everybody. Taking NCLEX very soon. Ooh, awesome. You got this. Oh, you have got this. All right, let's go to our next question. I gave points? Yep. Next question. Wait for it. Okay. Sure, let's do this one. Fundamentals. Fundamentals for 200. The nurse is preparing a continuous IV infusion at the medication cart. As the nurse prepares to attach the distal end of the IV tubing to a needleless device, the tubing drops and hits the top of the medication cart. Which is the appropriate action by the nurse? Remember to say what is if you want these points. 1, change the IV tubing. 2, attach a new needleless device. 3, wipe the tubing port with betadine. Or 4, scrub the needleless device with an alcohol swab. Alex said I just did this question to Archer. I'm glad you said that, because another reason why you guys should always do practice questions is because you can only ask these things so many ways, which I'm pretty sure is why they're changing the NCLEX format to begin with, okay? It starts to become like repetitive, especially if you've been taking practice questions like daily. It starts to become repetitive. You start to see the same thing. And that just lets you know that like this is stuff that's important, that's being tested, that they really want to make sure that you understand. And then everything else is really just fluff. So that's why it's very important whenever you are doing your reviews, you find a review, find a study guide, review book, whatever that is compatible with your learning style, whether it's visual, kinesthetic, audio, reading, writing, doesn't matter. Nothing is wrong or right. It's just individualized for you. Okay. All right. So let me see. Remember to say why. Dora said she thinks it's 1 because the tubing is now contaminated. Okay. Taylor said it's going to be contaminated, so you got to start over. Let's look and see what that answer is. And drum roll, please. What is 1? Change the IV tubing. But we knew this already. But y'all knew this already because y'all got that. NCLEX who? NCLEX who? Current or next gen? What's up? What's up? Great job, everyone. All right, so it says the nurse should change the IV tubing because it has become contaminated. And it could cause a systemic infection to the client. Wiping the port with betadine is insufficient and would be contraindicated in any case because the tubing will be attached directly to an angiocatheter in the client's vein. The needleless device has not been contaminated, so it does not need replacement or cleansing. Okay, it wasn't the spirit stick falling, all right? Don't drop the spirit stick. Don't drop your IV tubing. If you do, you got to throw it away. So great job, everybody. First person to get what is 1, though. Wait for it. Wait for it. Taylor 214. Wait, am I reading the right thing? Wait, hold on. Wait. Yeah, okay, right. Yep, Taylor 214. Awesome job. You got another 200 points. So Taylor, you are now at 500 points. Then we have, this is Portia with 400. And then Shanita, Jasmine, and Tori with 300. It was such a close game. All right. Everyone's like within 100 points of each other. But Taylor is in the lead. We have one more question. And that's going to be, I won't say our tiebreaker, but that's going to be, it's going to determine who wins. Who wins the bundles. Okay. Great job, everybody. That said was great job. There are 2 oranges. Which one tastes more like an orange? For real. For real. And the answer will be like the second orange because it's been an orange longer. So it's had time to taste like an orange more than the first one. That's funny. All right. So I gave those points. How often do you do this? I do this every Thursday. The needleless device is, it's like the connector. Okay. Have you ever seen like you know what a Lure lock is? Like a LEURLOCK, that Lure lock. It's like that basically. It's literally, if you have a device with a needle, the needle can be taken off to reveal like a Lure lock, and without that needle, that Lure lock is there. It's just it's a tube that connects basically. All right, so next is our final question. And this is Peds. Ooh, for 500. This is a good one. This is a good one. Okay, so I don't know where y'all at. If you're driving, cooking, do whatever. If you're about to take Peds, or if you're going to be taking Peds at some point, have taken Peds, don't know, don't care. If you're about to be taking NCLEX at some point in your life, and you will be because you're in nursing school, you will see this. You will definitely need to see this. Okay? Do me a favor and at least attempt to answer this question. Okay? All right, let's go ahead and do it. This is Peds for 500. This is like our boss question. Okay? The clinic nurse reads the results of a tuberculin skin test on a 3-year-old child. The results indicate an area of induration measuring 10 millimeters. The nurse should interpret these results as which finding? 1, positive. 2, negative. 3, inconclusive. Or 4, definitive and requiring a repeat test. Okay, let's go back up, right? This is pediatrics, right? Okay, great. This is pediatrics for 500. And even if we did not know this is pediatrics, because obviously they won't have, on the NCLEX, they won't have like, oh, this is a peds question. You just got to know. All right. Once again, let's read it one more time together. Okay. The clinic nurse reads the results of a TB or tuberculin skin test on a 3-year-old child. What did I say about paying attention to ages, the ages of your clients? That's all I'm gonna say. All right, the results indicate an area of induration measuring 10 millimeters. Okay, the nurse should interpret these results as which finding? Positive, negative, inconclusive, or definitive and requiring a repeat test? I'm making it like extra juicy. I'm so sorry, but this is really a really good question because it got me. I'm not gonna lie. It got me because I thought I knew everything. I thought I knew my stuff. And so I definitely was like, oh, okay, boom, 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 boom. And I got it so wrong and it hurt my heart. But look, I don't know about y'all, but you only have to get me once. I only have to get got once to learn from my mistakes. Okay. If you're not in peds yet, that is okay. Try out anyway, so that when you do get into peds, you'll be like, oh, I remember this question. You're not going to get me. Okay. All right. So let's go ahead. Y'all ready? Are y'all ready for the reveal? Are y'all ready for the reveal? Okay. Let's do it. All right. Oh, you're not going to rush me, love bug. Because you can Google it. All right. And Drum roll, please. The answer is, what is one positive? What is one positive? All right. An induration measuring 10 millimeters or more is considered to be a positive result in children younger than 4 years of age and in children with chronic illness or at a high risk for exposure to tuberculosis. Okay? And a reaction of 5 millimeters or more is considered to be a positive result or the highest or for the highest risk groups, such as a child with immunosuppressive conditions or a child with like HIV. And then a reaction of 15 millimeters or more is positive in children 4 years or older without any risk factors. Y'all see the difference? Y'all see the difference? Don't second guess yourself. All right. So even though 10 millimeters, when you think about it, you'll be like, oh, that has to be positive or whatever. You have to think about the age, and depending on that client's age, that 10 millimeters may mean something different. Okay. 10 or more, it's positive if they're 4 years and younger. And our client, per our question, was 3 years old. So if they're measuring 10 millimeters, and we know that the rule is 10 millimeters or higher for 4 years or age and younger, then we know that this 10 millimeter result is positive in this 3-year-old. Absolutely. If the client was not 3 and had 10, let's say the client was 5 with a 10 millimeter, it would have been, it would not have been positive, because if it's 4 years or older, positive is 15 millimeters. Y'all see what I'm saying? All right. Let me look and see what y'all got. It says, I learned that a positive skin test will then require another test. No. If you have a positive skin test, getting another test is redundant, because it's, especially if you're positive, if you were positive for the first one, it's most likely going to be positive for the second one. So even if it is positive, how they double check is via a chest x-ray. Okay. Via a chest x-ray. That's why they always ask during like assessments, physicals, anything like that. Have you ever had a positive TB skin test? Yes. Then you need your chest x-ray instead of the PPD placement. No, then you get the PPD placement. Okay. Let me look and see who got this one right. And I'm gonna read and leave what y'all saying. Who said one? Who said one first? Wait for it. I'm waiting for it. Sorry, there's a lot of messages. Trippy Trinks. X Trippy Trinks. All right, so X Trippy Trinks. Awesome job. You have won those 500 points. Look at you. Great job. So everyone that got what is one, snaps to you. Great job. Pat yourself on the back, because like I said, we always celebrate our wins, small, medium, big, whatever. That was not, don't sell yourself short, okay? Pizza's hard. I barely passed this last week. Listen. All right. Let me see what y'all saying. Let me go back down. And I Love Indy also added something else that's very important. If they got the BCG vaccine, which is common in different countries, like in other countries, it will always be positive. So they always ask you that as well. Great job. Which is, yeah, or Amy said it, or quantiferon gold, which is the BCG. Awesome job. Oh, look at y'all knowing the chest x-ray. Stop. I am just so proud of y'all. Okay, guys. I'm so glad you loved it. All right, so we're going to be doing this every Thursday at 7 p.m. right here on TikTok. Okay, free every Thursday. If for some reason there's something comes up and it won't be a live, I at least put them in my stories on Instagram, so that way you guys can kind of like choose the quiz feature and choose the right answer, and you'll be able to see, just like we went from question slide to the answer slide, it'll be like that as well. All right. Oh, sorry. See, 7 p.m. Eastern Standard Time. 7 p.m. Eastern Standard Time. Absolutely. Okay. Now, we played like about 8 questions, 8, 9 questions, maybe 10, who knows. If you guys want to play the full 25 questions, hence NCLEX Jeopardy Mobile, then all you have to do is download my free app, which is called The Nurse Sam, free to download, NCLEX Jeopardy Mobile, free to play. All right. The mobile version is exclusive to the Nurse Sam app. You can't get it anywhere else. You can't play it anywhere else. And if you want to, like I said, play the full 25 questions, so you get 25 questions every week. If you want to play those, you have to do it via downloading the app. Okay, you can go to the link in my bio, link in my profile, right after we get off live, and click where it says download the app. Once again, free to download and free to play for Apple, Android, both those. Okay. When you open it up, go to NCLEX Prep. It'll look kind of something just like this. NCLEX Prep, and then hit NCLEX Jeopardy Mobile so you can play the free game. All right. 25 questions every week for your review, for you to practice and make progress. Okay. I said it then, I'm gonna say it now. Those practice questions are one of the best, if not the best way to really drive that information in and really comprehend it. Okay. And then I just sprinkle in some razzle dazzle, some fun, some themes, something fun to make it like actually exciting. And boom, there you go. You're retaining stuff that you wouldn't even have retained before if it was boring. Okay. Thank you. Prior to taking the test. Right. 700 questions prior to taking the test. Awesome. Awesome. All right, guys. So like I said, if you want to go on right now and play the 25 questions that are already within the app, you can. And then tomorrow, or really like at midnight, it'll change to the new set of 25 questions. Because right now, last week's questions are still there. And then after we get off of live, that's when those questions change over. Okay? 25 new questions every week. All right. Now, if you want to keep coming back to these NCLEX Jeopardies, please subscribe to my live on TikTok. Okay. It is free to subscribe. This way you won't miss out on any of the future NCLEX Jeopardies, which, like I said, we have every week. If we have any like extra sessions, sometimes I'll just randomly just come on and just do a quick review with you guys. If you are a subscriber, you will definitely get notifications so you don't miss out on that free and fun group review. Okay. I'm so glad you guys enjoyed this. Once again, we do this every Thursday. Replays are going to be on my YouTube, and make sure you check out my TikTok for more NCLEX study tips, as well as my Instagram for more NCLEX study tips. All right. Thank y'all so much, and I will see y'all next week. Thanks.